Hello, everybody. Thanks for tuning in. I'm Andy Coat, Communications Associate at the Courant Shelter Medicine Program and the Million Cat Challenge. I want to thank you for taking time out of your day to join us for this presentation. Okay, let's get started. Dr. Julie Levy needs no introduction. She's the co-founder of the Million Cat Challenge, director of Maddie's Shelter Medicine Program at the University of Florida. She's got lots of good information, so Julie, take it away.
Thank you, Andy, and thank you, Maddie's Fund, for hosting this webinar for us. And thank you especially to more than 1,000 cat lovers out there that have signed up for this webinar. We're very happy to bring you the very latest information that just came out last week from the American Association of Feline Practitioners. This is a huge document. It was created by a panel of international experts in feline medicine and retrovirus research, 26 full pages of fine print and an extensive reference list. So if there is anything that you want to dive deeper on for managing cats with FeLV and FIV, it is in here, I promise. And this will be posted after the webinar. Today, we're going to focus on 5 key takeaways, breakthroughs that are new, that are different from the last version of the guidelines that were published in 2008. So we're going to be going fast. This is not planned to be a review of FeLV and FIV. That is available in other forums. This is to make sure that you have available to you the most recent breakthroughs, discoveries, and changing paradigms that are emerged this year. This is the lightning round, so hang on. These are the 5 key takeaways that I think are most important from these new guidelines. We're going to be going through each one and spending just a few minutes on each of these topics. So we're going to start with routine testing protocols, what would apply to testing cats in veterinary practices in animal shelters most of the time. We're also going to be talking about, for the first time today, some new research findings from our group. We've been working for the last 3 years on extensive testing protocols with naturally infected cats in an animal shelter, and we've discovered some very interesting opportunities and test patterns that we're sharing with you first today. We'll also talk about how it's been discovered that FIV is much less infectious than we used to worry about, at least among cats that get along, and so how that is changing what we think about managing these cats both in shelters, in their new homes, and maybe even letting them outdoors. And then a controversial topic of a paradigm shift for mass screening in animal shelters and in veterinary clinics. And then finally, why we think adoption is better. These cats are adoptable, they do better in homes, and we're going to show you why. But first, I do want to build a little bit of a foundation, so we are talking about the same language. Very briefly, these are both retroviruses. FeLV is spread primarily by close contact and by body fluids. So we're going to see most cats becoming infected because they were born to and cared for by their infected mother. However, they can spread it among housemates that live close together and by fighting. The most common outcomes for cats that are infected fall into 2 camps. There's the progressive camp, which is a cat that is what we think of as the classic FeLV infection, increased risk of illness, increased risk of an early death, contagious to other cats. And most of the time, we can identify these cats because they'll be positive on our routine testing. But we're also learning more about another group of cats, and these are called infections. These cats have a robust immune response to the infection, and they can beat it back. They don't eliminate it, but they might actually drive it down to a level that we can't detect it on a test, so our tests might be negative. When cats are in a regressive state, they are generally not contagious to other cats because they're not shedding virus. These cats may live a normal lifespan. And in contrast, FIV is spread primarily by fighting among cats. That's why we see it mostly in adult male cats, because they do have a history of fighting. And interestingly, when cats are neutered, that fighting behavior almost completely disappears. So usually even infected adult male cats are not at high risk for spreading it to other cats once that fighting behavior is gone. These cats are very unlikely to spread it within homes or shelters, though, even if they're living with uninfected cats, as long as they get along and don't fight. Most cats that have FIV infection will survive for a very long time, maybe even a normal lifespan. They'll never fight off the virus. FIV is a lifelong infection, but fortunately, most cats can live well with it. However, there are some that do develop clinical signs, such as stomatitis or other problems. We're going to spend a little bit of extra time today as we go through the topics, really focusing in on FeLV and this interesting branching between progressive and regressive infection, because this is where some of the most recent research breakthroughs and new algorithms for testing have emerged. So stay tuned for that. This is another way to describe the life cycle of FIV. It is a cycle. If we start at the top, cats spread it mostly by biting, but there are rarely cats that spread it through other ways. Generally, there's an acute phase, which we usually won't notice because the cats aren't sick enough to be detected, and then they'll spend most of their life in an asymptomatic phase. We can see perhaps evidence in the blood of immune dysfunction, but generally most people who have these cats won't know they're infected unless they're tested. And then at the end, they can develop such profound immunodeficiency that they might develop clinical signs, or they might never, and they might die of old age or something else. FeLV is different, and this is really key. This is new information that we understand better, and it's not probably what you've been taught in the past. So it's worth taking a moment to really think about this. Cats can become infected with FeLV if they have a very robust, immediate immune response. They can actually fight off the virus. This is called an abortive infection, and as far as we can tell, there's no virus that we can detect in these cats. Probably we won't ever know about these cats, though, because when we test them, they'll test negative. So some of the cats that we think are uninfected may actually have had a virus in the past, but fight it off. Then if they don't completely suppress the virus, but they do have a good immune response, the virus level will decrease enough that they will maintain their health. And these are the regressive infections. And depending on what tests we use and when we test them in their lifespan, they might have negative results, or they might have a positive test on our screening antigen tests, or they might have a positive test on an FeLV PCR test. And they can change over time. If they become stressed and their immune response is suppressed a little bit, that virus might start to rear its head again, in which case we might see more positive tests or higher levels in these tests. So as much as we would like to think of cats as being positive or negative based on testing them at a single point in time, that just isn't the biology. This is a continuum over time, and cats that are infected can actually shift between a progressive and a regressive state. So let's go into our topics now. I'm going to start with something that's probably pretty easy compared to some of the other topics, and that's routine testing protocols. And these would apply to animal shelters and to cats that are being seen as patients in veterinary clinics. Probably the most common testing approach is what I call testing option number one and done. This is the situation where we would use a point of care screening test like a SNAP combo test, and we would test them and they would have either a positive test or a negative test, and we might just stop there, even though we know that these tests may not be 100% accurate all of the time. The vast majority of the time, they will be accurate. I will point out, though, that if you are maintaining cats for blood donors or tissue donors, it is very important that you add a PCR test for screening, because the antigen test might miss some latent infections that can be passed by blood transfusion, but that's a pretty special circumstance. Option number two is a confirmatory test. This is adding another layer. So you can see that the first two steps are the one and done, where you can stop there. But if you are in a program that seeks to add a higher level of confidence to the diagnosis, you can add the confirmation test. And from my opinion, the best test is a PCR test. If that PCR test is negative, that's what we call a discordant test. So the PCR test does not have the same result as the screening test. And the important thing to understand in that circumstance is that we don't know which one is right. Even though we call that second test a confirmation test, it might not be the right one, and that screening test might be right. So this is one of the challenges and frustrations of trying to confirm tests. If they agree, both tests are negative or both tests are positive, we can be very confident about the result. But if they disagree, that's discordant, and it can lead to a very frustrating cycle of repeat testing, trying to determine which is the right test. And that's why some programs elect to do a one and done approach for most of their cats. If the cats have a negative result on the screening test, but we have a high index of suspicion that they've been exposed, for example, maybe they were just treated for a cat bite abscess outside and we don't know who bit them, or they come from a hoarding case with a high prevalence of infection, we might want to hold those cats separate and then repeat testing in 60 days to make sure we're not missing a recent infection. And there are a couple pitfalls that I have questions about periodically that I want to draw some special attention to. One is to be sure that you're using a good test. Not all of the brands are equivalent. Some are about as accurate as flipping a coin, and since these can be life or death decisions being made on the result, it's very important that you're sure that your program is acquiring the best tests. In the United States, that would be the IDEXX SNAP test or the Zoetis Witness test. Other brands can be less reliable. It's also important to use the test the way it was intended. These tests are highly calibrated to work in specific conditions. So, for example, the SNAP test must be brought to room temperature. The incubation times must be closely followed. And it's not appropriate to mix up several samples and run them in the same test, because if there's only one positive cat and it's a low level of antigen, you can miss it by diluting it. So make sure that your team is following the instructions very specifically. Also remember that even within a litter or a family of cats, the different individuals in that group can have different results. So it's not appropriate to test, say, 1 or 2 kittens in a litter and assume that they are all the same status. Similarly, it's not appropriate to just test the mom and assume she's going to be the same status as the kittens. Every cat needs to have its own individual tests if you're testing. So that is a pretty straightforward summary of the way we've traditionally approached testing, but now I'm going to move into probably what is the most challenging concept in this presentation. So new FeLV staging plans. You are going to have access to this presentation, so you'll be able to download these slides later. So don't worry about trying to grasp everything in a complex slide like this one. But this is some of the work I'm most proud of that we've been working on for the past 3 years. And I'm very excited to say that the research we've been doing with a national collaboration team is now being translated into diagnostic testing at reference labs. So based on the results that we've received from over 130 naturally infected shelter cats tested repeatedly over time, we've come up with this testing algorithm, and it's now available from IDEXX. So I'm going to walk through this and take a few minutes to make sure that it's hopefully really clear what I'm talking about. So on the left, we start out with our point of care screening. For FeLV, this is an antigen test. We're actually detecting proteins from the virus. So if it's positive and it's a reliable test brand, you can be very confident that the cat is infected. But that's the one-on-one testing. If you want to go to the next level and confirm as well as stage this cat's infection, we revert then to sending a sample to the lab. Remember that there are 3 different outcomes of infection. There's the cats that have such a great immune response that they abort the infection, and there is no infection left in this cat. They have a negative antigen test and a negative PCR test in this panel. These cats have a normal lifespan, and we probably won't ever know about them because they have they never will test positive in our hands. The second category is a cat that has a pretty good immune response but doesn't completely eliminate the infection. They are the regressive ones. These cats may test negative at times or may test positive on one test and not the other. In this slide, it's a blue category. And you can see there's 2 ways these cats may manifest on this PCR testing panel. One is the antigen test is negative, and there is a low level on the quantitative PCR test. The other option is that the antigen test is positive and the PCR test is negative. These both represent a regressive infection. These cats have a better chance of living a normal lifespan. If you test them at different times, this testing result may shift. And then the third outcome of FeLV infection is a progressive infection. These cats do not control the infection well, and so the virus is present at very high levels. The antigen test will be positive. The PCR test will be positive at a high level, and these cats are in the group that are more likely to have a reduced lifespan. But what you're seeing now that we didn't have before is if we run this test panel, we can give cat caregivers some ideas about the prognosis of their cat. So no longer are we just stuck at saying they have infection or they don't have infection, but we can say something about the care they're going to need. Why does this matter? We took our 130 cats and these testing panels and we put them into a survival curve. And what you see is these curves over time show how many cats are still alive over time. This is a 3-year follow-up study. At the top line, you have the cats that had aborted infection. They test negative on all of the tests, and in our study, all of those cats were still alive at 3 years. The second category is regressive infection. These are the ones that are partially controlling their virus, and we see that 90% of these cats are alive at 3 years. And then quite a difference for the cats that have progressive infection. These cats, half of them survived more than 1.5 years, and even less survived up to 3 years. So this new test panel tells us a lot about the cat's prognosis. But remember, these are averages, and some cats will defy these categories, and we certainly know of some cats with progressive infection that live for many, many years. So this is a guideline, but it doesn't guarantee the outcome for individual cats. So I'm going to show you some of the examples from the cats that we've been following over time. This is a study that we performed with our friends at Austin Pets Alive. They have a very big cat adoption program for cats with FeLV. And so what you see in this case is the month of testing. We tested them monthly for 6 months, and then we had a couple later time points as well. We tested them in a bank of tests over time with different samples, so whole blood, plasma, serum, the SNAP test, the laboratory PET check test, and PCR test. And then we now have this quantitative PCR, which tells us if it's a high or low level. We even ran IFAs. And so what you see in this case is this is a cat that would fall into that regressive category. His PCR is always positive, but it's positive at a low level. But if you look over at the antigen testing, you'll see he's positive on some days and not on other days. So if we tested this cat with a one and done test with the in-house test on, say, month 2, for example, you would have gotten a positive result and called this cat infected. However, you ran that same test on month 4, you would have got a negative result and called him uninfected. But since we have this new panel now, we can understand his status in much more detail and see that he does have regressive infection. But Jasper's regressive, and so he's likely to have a good long-term outcome. Let's contrast that with Basil. Basil came into the shelter at 2 years old, and she was positive all of the time on every test, and her PCR quantitative result was high level. So she is solidly a progressively infected cat. Now, we do put her in a camp that on average has a lower chance of long-term survival, but we've already been following her, and she's 2 years out, and she's still doing well. So she's defying her average odds. We do need to treat all of these cats as individuals. But don't get too confident that you understand all of this, because here's Crayola. Crayola doesn't like rules, and she likes to create her own categories. So at some points, if we tested her like at month 1, we would call her progressive because she's positive on all of these tests. But if we were to test her again at month 5, when she's negative, we would have called that an abortive infection, or maybe even we would have just thought she was negative. And then at other times, she beats the virus back and enters a regressive state. Or she might be negative on the laboratory tests, positive on the screening test, in which case we're discordant. So we will have some of these cats. In Crayola, we just have to say, we think she's infected, but we can't really stage her that well with our current paradigms. So that was a hard one, and it's probably going to take some time to really digest all of that. It did for us for sure. But let's take something really easy now. FIV infected cats. We know, we've always suspected that these cats do well. I've had lots of patients that have a positive cat in a household and some negative cats as well, and the owners didn't follow my advice to segregate them, and yet they never spread it. And we now know that there's some good research to show that if cats get along within a household, they're neutered, there's low stress, and there's no fighting, it is very unusual for them to spread this infection. So we're very confident now letting people adopt friendly FIV positive cats into a household with friendly negative cats, and even to co-house FIV positive cats in group housing in shelters. This is new, and I think a lot of shelters may already be doing this, or maybe have stopped testing for FIV altogether because of this finding, but it's going to be new to some of our friends in veterinary clinics that we're working with. The other little tidbit I'd like to share, though, for both FeLV and FIV, is there's now several studies that show that survival of infected cats is longer if they are in homes than if they live in shelters or sanctuaries. So I want to make an appeal that when you're starting your adoption programs is not to be thinking about starting sanctuaries or sending cats to sanctuaries for positive cats, but putting them in the homes that they deserve. They'll do better that way. And then this is probably the most controversial topic for the day. It's a shifting paradigm for mass screening of cats. Traditionally, shelters have often screened every cat in their care and then provided that information from the owner. And that's very expensive. The vast majority of cats that they test will be uninfected because we only see about 3% or 3 per 100 cats that are positive in shelters. And so we're spending a lot of money and staff time on a single point in time, which we know can underplay the complexity of these infections, when we often have better ways that we could spend those resources that would help save more cats. So neither of these viruses can be spread by single house cats. It's not like panleukopenia or upper respiratory infection that you can spread from cage to cage on your clothes. It actually requires very direct contact. So we know that with single housed cats, they are at zero risk for infecting other cats, so there is no urgency to test those cats while they are in the shelter. It's a little bit different when cats are co-housed. If they are FIV infected, we're pretty comfortable co-housing them, but we do not want to co-house FeLV infected cats with uninfected cats because it is more transmissible. So we would want to be sure to screen our cats for FeLV before putting them into group housing. The new guidelines have a section on this trend of shifting away from testing every cat in a shelter to transferring that testing to the veterinary practices where cats will receive their lifetime comprehensive care. So this is a summary, I think, that really spells out well how we should be thinking about which cats we must test in shelters and which we can transfer that level of care to their new veterinarian. So high-risk cats in shelters, if they're sick or they have a history of exposure, that can be a very helpful part of the database, is knowing their retroviral status. So we know how to help those cats the best. If we're going to group house cats, we can test them so that they don't spread it within the group. We might also want to test our legal cases or our hoarding cases, because that can be part of the database we need to process those cases. And then we also sometimes want to know the status of a cat before we do a major medical intervention, such as repairing a fracture or treating a very ill cat. It's also extremely important that we have outstanding communication with both our adopters and the local veterinarians who are going to be taking care of those cats. It is kind of a shift in the tradition that we don't want anybody blindsided or not understanding what shelters are doing now. So our adopters must understand that their cats have not been tested yet. They need to make an early appointment with their new veterinarian and segregate the cat from their other cats until that testing is done. We want to assure that there is a really smooth handoff of care from the shelter staff to the new veterinarian. That means good records and good communication. And we want our local veterinarians to be empowered to support these adopters and the cats that have FeLV. So sometimes in town there's some local veterinarians who really like working with these cats, and we can maintain a referral list for them. But it's important that we get out in front and inform the local veterinarians what the shelter protocol is. And here's an example from Edmonton in Canada. When they reduced the amount of testing that they performed, they worked with local veterinarians to make sure they were in the loop. They distributed a flyer here that is a good example, and we can provide that to folks on this webinar who want to see examples. And they explained that they were still testing their high-risk and sick cats and group house cats, but no longer testing the single house cats and the kittens. And for them, this protocol worked really well, and the transition of bringing their local veterinarians into the group also was a very positive collaboration. So in the new guidelines, that 26-page report, you will see a summary here specifically of recommendations for testing and vaccination in shelter cats. And this is the new standard of care that applies across North America. And so finally, I'd like to wrap up with the happiest part of the new guidelines and trends in this field, which is adopting these cats. As we all know, in the past, these cats sometimes were euthanized because of shelter crowding or not feeling like we could be comfortable putting them into homes. And we now have lots of experience with good programs that are showing how successful this can be. So this is where I take my hat off to Austin Pets Alive, which has long had an adoption program. Hundreds of cats are referred from across the country every year to their shelter in Austin to enter the adoption program. And they've been a research partner with us for the past 3 years, trying to suss out the best qualities of this program and the outcomes for the cats. And what we've learned is we don't have to send all the cats to Austin anymore. All these shelters that are currently referring can start their own programs so we can save more cats. This is a study we just finished with 800 cats that had been referred to the Austin Pets Alive adoption program. And what we see is right off the bat, when these cats were retested with more critical level of testing, that almost 20% or 2 out of every 10 cats weren't even infected when they were referred. Of those cats that were referred, 80% of them were adopted. A few of the cats died or were euthanized. Remember that a lot of these cats were referred as sick cats, and then a small number of the cats were still in the shelter waiting to be adopted. But these are great numbers that should be extremely encouraging for all of you out there to be thinking about starting your own programs. What do adopters think when they adopt a positive cat? Austin Pets Alive also did an adopter satisfaction survey, and it was really remarkable and I think surprised us all. The vast majority of adopters felt very positive about adopting a cat that had FeLV. They were actually often expressed pride in saving a cat. And the vast majority also said that they would adopt an FeLV cat again. So this is really good validation that when we give adopters the right support and the right education, we can have very successful adoption programs. I love how Treehouse Humane Society, which started an adoption program for cats, developed some really positive PR about their cats. I think one of the ways that these programs can be most successful is that we don't throw up a lot of warning signs up on their cages and their cage cards, and that we present them first as great cats and then talk about their FeLV positive status or their FIV positive status after getting somebody really interested in the adoption. When the Treehouse Humane Society started their program, they made a big deal about it and publicized what a good success this was, and it has been extremely successful. They have excellent fact sheets that go home with their owners and the new veterinarians, so everybody's well informed. And what was amazing is their program was so successful that they turned their cat cafe into an FeLV positive cat cafe. And this is wonderful. So this is showcasing these positive cats in the best part of the shelter. And they aren't the only ones that are doing it. There's also this amazing cat cafe in Seattle that focuses only on FeLV positive cats from the region. And this one even has a wine bar, so it's one that I'd like to visit. Who wouldn't want to adopt a cat from this beautiful place? And I really want one of those tables. So this is a quote from Maddie's fun, Dr. Sheila Darpino, who's been tracking all of this research, and I think she sums it up really the best. She says, people are adopting these cats, loving them, and not regretting it. We see this over and over again. I think we can all embrace these new adoption programs now. They are so rewarding. So this concludes the formal part of our presentation today, and I would like to throw up a poll now to hear about what you're thinking about your adoption programs for 2020. So here's the poll. It says, if your group performs cat adoptions, how do you plan to manage the positive ones in 2020? And the options are, we don't usually test, so we'll be pretty much status quo. We're not able to adopt out the positive cats. We'll be adopting out the cats with FeLV. We'll be adopting out the cats with FIV, or we'll be adopting out all of the cats with FeLV or FIV. Please tell us what your plans are for 2020. And our pollmeister can reveal the results of that poll. Oh, yay, this makes me smile. So most folks are planning to be adopting out their cats with FeLV and FIV. I see only a few of you that are still feeling like you don't have an option to adopt out positive cats, and we encourage you to stay in touch with Million Cat Challenge. We can connect you with other programs that really are bright stars as far as starting these and can mentor you through it. Starting with a pilot project is often a really good way to get started if your organization is anxious about it. If you still have questions, reach out to us and we're here to help. But this is really one of the fresh frontiers of 2020 for saving vulnerable cats. So that's the end of our formal presentation, and I would love to open it up to questions now.
Okay, just to remind everybody, we're going to keep this going for another 9 minutes or so, and if we don't get to all the questions, you can always follow up at Maddie's Pet Forum in the webcast group, and I'm sure we'll have some more back and forth there. But let's see, our first question is, the FeLV testing protocol didn't include IFA. Is that still a useful test?
So the IFA was the original test that was developed for FIV or FeLV when it was first discovered in the 1970s, and it has been a very good test when performed in certain laboratories. It still has value, but what we miss with the IFA is that ability to stage the cats that we now have with the quantitative PCR. So I think it is more just straightforward to go with the new IDEXX laboratory panel that gives us the in-laboratory antigen test paired with the quantitative PCR, so we can confidently stage those cats into regressive or progressive infections. However, if you do want to continue to run IFAs, there is really only one laboratory that I recommend. It is a laboratory that invented the test back in the 70s, and they still do a great job, and that's the National Veterinary Laboratory in New Jersey. It's a difficult test to run, it's somewhat subjective, and so we haven't had as much confidence in the results that come through on the big diagnostic laboratories as we do with this custom lab.
Okay. Do the new testing protocols apply to kittens as well as cats?
For the most part, the new testing protocols can be applied to cats of any age. There are some nuances that we won't get into when testing underage neonates, but as far as weaned kittens, 8 weeks and older, they really do apply. Of course, everybody knows the one exception is finding FIV antibodies in a kitten less than 6 months of age. If a mother cat was either infected with FIV or vaccinated against FIV, she will pass those antibodies to her kitten. And for a period of a few months, that kitten can test positive on a routine screening test. They won't be positive on a PCR test, so if there's any question, it's always fine to go submit a PCR test, or just hold those kittens aside and retest them over time, and they'll usually turn negative by 5 or 6 months of age.
Okay, I think you touched on this a little bit, but here's a question that says, we are excited to be starting our first adoptions of FIV and FELV cats. Do you have any advice for a successful launch?
So I'm happy to say that we've been able to witness several successful launches of retrovirus positive adoption programs. And I would say that most of them originate because someone in the shelter falls in love with a positive cat, and it just is the spark that gets them confident to try something new. So it's always safe if there's reservations to think of it as a pilot program and to start small without any long-term commitments. But when you're ready to jump in full force, I think having a real positive attitude and communicating that to adopters and in your marketing is very important. These are cats first, and they are living with a retrovirus second. So your pet finder pages and your cat profiles and Facebook, they should just talk about the qualities of the cat. And then if somebody hones in on wanting to adopt that cat, after talking about the positive qualities of the cat, is a time to bring up the retrovirus status and how the shelter is there to support them in adopting this cat if that's what they want to do. So take just a real positive vibe about it, give them the best space in the shelter, and your program will be very successful. These cats will get adopted as fast as the uninfected ones do.
Okay. Is it possible for an FELV cat to alternate between regressive and progressive over a lifespan?
Yeah, it sure is. And these are these cats. I showed one example of a cat like that, where if we test them over and over, their status does shift. And that just reflects the fact that their immune system may be stronger at some points in their life than others. So if they develop a co-infection or a life-threatening disease, or perhaps they're pregnant and stressed by raising kittens, all of those can suppress the immune system, which allows that virus to come back up. And so for a period of time, they may express themselves as progressively or regressively infected cats. And those cats that come back out of regressive infection can develop clinical signs of disease. Now, understand too that it hasn't been that long that we've even known about these different phases, so there's not a lot of cats that have been tracked over their lifetime. That's what we're planning to do with these 130 cats that we're tracking now, but we still have a lot to learn about what happens to regressively infected cats over the decade or more that they might be living.
Okay. during kitten season, we have a lot of kittens that are being treated for URI. What symptoms would you look for to determine when testing is indicated?
That's a really good question. There's nothing very specific about kittens with URI that would tell you that they may be co-infected with the retrovirus. I think any time that a cat is not recovering from a disease, that, as you expect, is a good time to test to make sure there's not more going on than meets the eye. But I want to kind of diverge a little bit and talk about if you're having a lot of kittens that are acquiring URI in the shelter, not kittens that are coming in with it, but cats that you kind of notice a pattern that you have a high rate of cats that come in healthy and then they develop URI. It's probably signaling problems with crowding, perhaps shelter housing that is not up to snuff to control stress. So, reach out to Million Cat Challenge for sure if you're struggling with high rates of URI, because we now know that there's a lot we can do to divert kittens from entering the shelter in the first place, or to reduce the chances that they get stressed and develop disease in the shelter.
Okay. What about FIV positive cats who are not suited to be indoor pets? Is it okay to put them outside?
That's a good question, and in the past we might have had more anxiety about putting these positive cats back out there because they have been viewed maybe as a point source threat in the neighborhood. But we now know that the neighborhood probably has other FIV infected cats, and the ones that really are the threat are the ones that aren't neutered yet. So the cats that are placid and neutered and not biting can be put back out in the neighborhood, in my opinion. Also, I think these cats are good candidates for working cat or barn cat relocation program if you don't know where they came from in the first place. We didn't touch on it because there's not any new information really emerging about that, but in your big TNR programs, it's not recommended that cats be routinely tested in TNR programs, because we know we can do better about controlling reproduction and controlling the spread of both viruses simply by scaling up the amount of neutering we do in those TNR programs.
Okay, thanks. It looks like we're getting very close to 12:45, so we're going to cut it off there. Thank you, Dr. Levy. Thank you, viewers, for watching. For those of you who'd like to continue today's discussion or have more questions for us, please go to Maddie's Pet Forum, to the webcast group. And if you missed any part of this or just want to see it again, the slides are up at the Million Cat Challenge site. And tomorrow, the Zoom link that you received, you'll be able to go watch this again. So a big thanks to Maddie, the little dog that started it all. And thanks to everybody for watching. We hope you have a great afternoon.
Thanks, everyone. It was really a pleasure to be here today. I'm so excited to see how much interest there is and how much enthusiasm there is for saving these cats. If you're in a shelter and you haven't joined Million Cat Challenge yet, please do. Our shelters have saved over 2 million more cats in the past 6 years, and you can be part of this amazing trend. Have a great day, everybody.